All right. Well, I'll hand it over to you, Reggie and Sarah, to kick us off. Thanks so much for being here.
Okay, well, thank you, and yeah, no, thank you all for taking the time to talk about or learn more about PFML around 5:35 as you're leaving the day for work. But I'm Reggie Parson. I'm the deputy director for the PFML program, and I also brought two other people with me that are very knowledgeable about the program. Sarah Bryden, who's our PFML Claims Administration Division Director, and Sophia Khalid, who's our PFML Policy and Outreach Specialist. So Sarah will be leading today's presentation, and if you do have any questions as she's going through the PowerPoint, just feel free to put them in the chat, and then when she is done with her presentation, we'll read those questions out loud. And so with that, I will actually pass it off to Sarah to introduce herself.
Thanks, Reggie. Thanks, everybody, for joining. I'm so glad to be with you for this hour talking about Maine paid family and medical leave. Like Reggie said, I am the Claims Administration Division Director for the Maine PFML Bureau. Really, really excited about the start of this program. If you have seen any other communications from us in the last, bunch of time, you'll know that benefits are starting on May 1st, which is Friday. The team is very excited, and so I just really am glad to be here to talk about the program. I do know it's kind of a tough time of day, so I'm going to try to talk at a relatively good clip. There's a lot of content. Try not to talk too fast, but also leave enough time for Q&A, and then get us all out and off to dinner by 6:30. So let's see if we can do it. Okay, let's see. So getting over to the deck. Here we go. All right. So there are three main areas of content that we're going to cover in the next bunch of minutes. First, we're going to talk through the basics of Maine paid family and medical leave. This might be a bit of a refresher for some, but I want to make sure everybody is sort of grounded in a shared understanding of what the program is, who's covered, those sorts of things. Second, we're going to talk about ACLAC, which is the company that the Maine Department of Labor has selected to be the administrator for the program. So they're doing all the administrative work of tracking and reviewing and approving and all of that. So we're going to talk about their process, how it will work. And then finally, the last section of the presentation is a few things to keep in mind for how workers can engage with this process when they need to take paid family and medical leave, and some things to keep in mind to make sure that the process goes as smoothly as possible. And then as we go through, I also I understand there might be some folks in the attendee list here who are from the employer side. So I'll try to point out where there's some information that's relevant there. Also, just want to make sure everybody knows that if you go to maine.gov/paid leave, which I will say another few times before we're done, there's a lot of resources there as well, including some recorded webinars intended for an employer audience. So if you get to the end of this presentation and you're feeling like, I really would like to see some of this information tailored for an employer perspective, that's available on our website in a recorded format. So let's get into the basics and making sure that everybody has that foundational understanding of the program, sort of a 101 level discussion. The first part of this that I want to talk about is who we're talking about, which workers in the state of Maine may be able to take paid family and medical leave when benefits begin May 1 of this year. If you are familiar with paid family and medical leave programs in other states, there are some states that have some level of constraint or restriction. By comparison, the Maine paid family and medical leave program casts a pretty wide net. So we are talking about almost all employees in Maine, regardless of employer size, those sorts of constraints. But it's not everybody. So almost all employees in Maine, as long as the person applying for leave meets certain criteria. So a person would need to meet the program's earnings requirements. be out of work for a covered reason, provide documentation related to that reason, and also have time within the program left to use. All of these things we're going to get into in more detail in subsequent slides, but at a high level, that is sort of an overview of who might be able to take paid family and medical leave under our program. There's a couple of categories of people or situations where coverage is optional. So tribal governments in Maine that are employing workers can choose to participate in our program and have their employees covered that way. And then also self-employed individuals can choose to participate, can elect coverage, can opt in and get coverage that way. So the at the top of the slide, the word almost is really important. Almost all employees, not all employees. There are a few exceptions, specific types of employment that's not covered under our law. A few examples, federal government workers, work study, and incarcerated workers are examples of carve-outs under our law. Generally speaking, those carve-outs, those specific situations, for the most part, would have already been identified through the process of figuring out back January of last year who needs to be included in contributions and wage reporting data that began a little bit more than a year ago. So wanted to just sort of explain that, again, our program casts a wide net, but it's not every single person in the state of Maine who's working. So for that category of employees that are covered by our program, the next key piece of information I want to make sure everybody fully understands is the amount of time we're talking about. So how much time could an employee be approved for under our program? And the quick answer is 12 weeks, but it's really a little bit more complex than that. So our law allows an employee to take up to 12 weeks of paid family and medical leave in a 12-month period. And that it's a very specific 12-month period as outlined in our statute called a benefit year. And what that means is what you do is you look at the first day of somebody's leave. The Sunday of that week is when the benefit year starts. And then the 12-month period after that Sunday, that 12-month period is the benefit year. And that's the time within which the person's 12 weeks of paid family and medical leave is measured. Up to is also a really important phrase. It's in italics for a reason because it's doing a lot of work in that sentence. Specifically, as we've seen from other states that have rolled out PFML programs, not everybody who takes leave takes a full 12 weeks. So the intent here is really to be the amount of time that somebody might need to take off from work for specific reasons. And sometimes that's going to look like 12 weeks. Sometimes that's going to look like 4 weeks, whatever the person's life scenario is presenting. And we will, again, get to those leave reasons and scenarios a little bit later in the presentation, but up to 12 weeks. It doesn't have to be taken all at once. It can be taken in blocks of time, so all 12 weeks at once, if that's what the worker needs, chunks of a few weeks, and then potentially back to work. And, if needed, out again. Intermittent leave, if you are familiar with federal or state FMLA, you might have seen the terms intermittent and reduced schedule. Intermittent leave is generally for absences that are a little bit more sporadic. Sometimes they're related to medical conditions where somebody might have a flare-up or need to go to the doctor or something like that. And then reduced schedule is really around an adjustment to somebody's regular work schedule that's more repetitive or repeatable. So, for example, if somebody works Monday through Friday and they need to instead only work 3 days a week, that would be an example. An employee can take partial days of Maine paid family and medical leave if the employee and the employer agree. Otherwise, leave would be taken in 1-day increments. But in every circumstance, whether there's agreement or not, PFML in our program is designed to be taken in 1 hour increments, 1 hour chunks. So we're not talking about, 17 minutes of leave. We're not getting that granular. It's 1 hour increments at the smallest. So if you're reading along on the slide while I'm talking, you'll see that there's one bullet point that I have not addressed yet because I'm going to go into a little bit more detail on the next slide. And that is to do with how Maine paid family and medical leave is intended to interact with other leave laws that are potentially applicable depending on the workplace setting. So the idea and what's envisioned for our program is that if federal or Maine state FMLA are applicable, the idea is that Maine PFML, federal FMLA, and Maine FMLA would all run concurrently and run together. The idea is not that an employee would be able to say, I'm going to take my federal FMLA all 12 weeks, and then I'm going to save my Maine paid family and medical leave to use after that and functionally get 24 weeks of leave. That's not how our law is designed, and that's not the intent. So our program has a provision that says if somebody is applying for Maine PFML, part of the review is to ask essentially, in the last 12 months, did this person take federal or Maine state FMLA without Maine PFML running along with it? And if so, how much? And so that amount of leave previously taken can reduce the employee's 12 weeks of Maine PFML moving forward. Got a couple of hypothetical scenarios here. Just the left side is intended to show how a hypothetical scenario might play out if an employee takes 2 weeks of leave in February of 2026 before the Maine PFML program starts. Those 2 weeks are approved as federal and Maine FMLA. And then when that employee goes to request leave in July of 2026, potentially could only have 10 weeks available because of the 2 weeks taken in February, because that's within that 12-month look back period. And then on the right-hand side, you have another employee taking 2 weeks of time in February of 2026, but it's not federal or Maine state FMLA. That then does not become a reason to deduct 2 weeks of time from a potential subsequent request in July of 2026. That employee is going to get all 12 weeks because this provision of looking back and reducing available leave is not going to apply because those 2 weeks were not federal or Maine FMLA. So little bit of detail on that. So the next thing that I want to make sure everybody has a really solid understanding of is the reasons why employees might be able to take and get approved for benefits under Maine paid family and medical leave. Again, if folks are familiar with federal or state FMLA, some of these leave reasons are going to be pretty familiar, but I want to make sure that everybody is grounded in the same foundational understanding. So the first reason, which is across states, one of the most common reasons to take leave is bonding. So bonding with a new child. If an employee is welcoming a new child, either through birth, adoption, or foster care, that's a potentially approvable reason for somebody to be out under Maine paid family medical leave. Caring for a family member with a serious health condition. Also, a leave reason that is present and covered under other existing leave laws. Military family leave. Military family leave specifically is not for a worker who's in the military, but rather for a worker who has a family member in the military, and that family member is potentially being deployed. And really the reason why the worker would be out of work in this circumstance would be to deal with some of the arrangements that might need to be made related to that family member's deployment. So making new childcare arrangements, having to, go to, the bank and make some financial arrangements, things like that. Military activities, Also, spending time with that family member who's been deployed, who is home for R&R leave, those sorts of things. Um, Medical leave is specifically for when the worker themselves has a serious health condition that prevents them from being at work. And then safe leave is actually not covered under federal FMLA, so it's a little bit of a nuance in our program. But safe leave is leave to seek safety if the employee or their family member is dealing with abuse or violence. If you're reading along on the slide, you'll see those little sub bullet points in the bullet point list are the family members that are the listed family members that are covered for each of the relevant leave reasons. And if you're reading closely, you'll see that they are a little bit different. So the caring for a family member list is the longer list with a lot more people listed. And that is because that list is specifically in the Maine Paid Family and Medical Leave law. And so it lists out all of the family members that you see on the screen. Whereas the military family leave that is specifically for employees, spouse, child, or parent, that is that family member list because the Maine Paid Family and Medical Leave law points to federal FMLA to say, okay, one of the leave reasons in our law is the military family leave concept from federal FMLA. Federal FMLA provides for the employee's spouse, child, or parent to be the covered family members there. And then, and this is really in the weeds, Maine PFML trivia, but the Maine PFML law also points to Maine FMLA, Maine Family Medical Leave Act, unpaid, to point to that law for the purpose of leave in the event that an employee's spouse, domestic partner, parent, sibling, or child dies while they're on active duty in the military. So that's why those family member lists are different and nuanced. It's because the care for a family member one is from our law, then the other two are pointing out to federal and Maine state FMLA, respectively. All right, so that was a lot of content, a lot of foundational knowledge. And next, we are going to move into a discussion of AFLAC and what AFLAC is going to do for the people, employers, and workers of Maine as the administrator of the Maine Paid Family and Medical Leave Program. If an employee finds that they need to be out of work for one of those reasons that we just talked about, specifically if that person's employer is participating in the public plan, then that person will need to contact AFLAC. If an employer has a private plan, then that's a different story, and employers are expected to make sure that all their employee populations know where they need to go to file for Maine Paid Family and Medical Leave. But in today's conversation, we are focused on the public plan, and that's being administered by AFLAC. So an employee who needs to take leave would start at maine.gov/paid leave. I'm going to say it at least another 3 times before the end of the hour, but it's a really important resource. So maine.gov/paid leave is our Maine PFML program website, and is also where you will find the link to get to the AFLAC website. So AFLAC has an online portal, and that can be used for creating a claim and a host of other things that we'll get to in an upcoming slide. They also have a call center that is staffed Monday through Friday, 8 a.m. to 5 p.m. for folks that might feel a little bit more comfortable talking to somebody versus using a portal. But that phone number is also where you're going to go to get that information is maine.gov/paid leave. It's also, I want to take a beat and talk about the notification expectations that the program really envisions. So the Maine Paid Family and Medical Leave program envisions that there's going to be a conversation between employees and employers. So the intent is not to have employees submit a claim to AFLAC, and that's how the employer finds out, oh, somebody needs to be out. That's not the idea. That's not the hope at all. Employees are expected to notify employers when they know they're going to need to be out. Generally speaking, if the time away from work is something that the worker knows about far in advance, 30 days notice is generally considered reasonable. Sometimes, people need to be out of work because life has thrown a curveball that's not known in advance. And so if we're talking about a situation that's more of a sudden situation or an emergency, then really the expectation is that the worker let the employer know as soon as feasible. And that notice process that, hey, I need to be out of work, is intended to be in writing, which could be a text or an email. Doesn't have to be a letter, but it could be a letter. And it's intended to include key information like why, the leave reason, and the timing of leave. So when the time away from work is going to start and how long it will last. So you have your worker who has let their employer know need to be out of work, and they've either gone to the AFLAC portal or called AFLAC and set up a claim, so submitted an application for Maine paid family and medical leave. And again, AFLAC is the administrator who's going to be running all of this process on behalf of the state of Maine. So AFLAC's first step, once they take in that application, is going to be to ask the question, okay, is this person eligible to receive benefits under this program? And the key eligibility question is to do with an earnings requirement. So like I talked about a little bit earlier, premium contributions and quarterly wage data have been being collected from employers since January of last year. So all of that information, it has been compiled and is being compiled at the close of every quarter. Employers are sending in wage data and remitting premium contributions. So the money is piling up so that we have a fund from which to pay wage replacement benefits. And we also have this wage data that we are making available to AFLAC so they can answer this question. Is this person eligible? Have they met the earnings requirement? The earnings requirement in the law is a very, very specific question. The employee has to have earned a certain amount in working in Maine in a certain time period. So the amount is 6 times the state average weekly wage. And so the state average weekly wage is a number that gets published every year. So it changes every year. Right now, it is $1,199. And later in 2026, that will get updated and published, and we will update, all of the calculations that are related to this. But for right now, the total earnings that somebody would have had to have is $7,194. And so that has to have occurred within a certain time period. The time period is called the base period, and it's defined as the first 4 of the last 5 completed calendar quarters before the start of the leave. It's a mouthful. It's confusing. It's like, why are you doing it that way? It's this way for a couple of really important reasons. So the first reason is that, so it's 4 calendar quarters, so it's a year. And so by looking at somebody's earnings over that amount of time, it really allows the program to look at a holistic view of what this person has been earning. So if you have somebody who is doing seasonal work or, might have fluctuated in terms of their income over the course of time, it's not just looking at, well, what did you make last week? What did you make last month? It's really a year's worth of earnings so that we can even out some of those fluctuations. And then the other piece of why this sounds more complicated but is really intentional has to do with the first 4 of the last 5. if we were to just look at the last 4 calendar quarters before somebody's taken leave, what we would run into and what AFLAC would run into is a lot of situations where that most recent data just isn't in the system yet, because employers are, again, remitting contributions and providing wage data at the close of each quarter. So January, February, March, that's quarter one. At the end of March, that's all the data from January, February, and March. And then employers have really until the end of April to give that data to the program so that it can be included and leveraged by AFLAC to answer these eligibility questions. So if somebody were to, for example, create a claim and apply for leave in April, and the data's not in yet, then that slows down the process. So by having that gap quarter, so the 5 quarters, the last one's not relevant, the first 4 are. By having that gap quarter, it really allows for AFLAC in almost every situation to be able to say, okay, there's this new claim. We have what we need for data, so we can arrive at a quick, efficient, accurate determination of whether this person is eligible, and not make anybody have to wait, not chase data, none of that. So again, AFLAC is going to use that quarterly wage data to answer these 2 questions: whether the person earned a certain amount in the certain time period, and move forward if the answer is yes. So the bottom of the slide, just want to take a moment and really highlight this part. The wage data that is coming in that AFLAC is using to answer these questions, it's from all Maine employment. So if somebody is working 2 jobs, 3 jobs, switching jobs, this is a portable benefit. So Maine paid family and medical leave benefits are not tied to, it's not a matter of you have to stay at one particular employer in order to remain eligible. You can move around across Maine employers and still avail yourself of this benefit that you've been paying into. All right. So let's assume that somebody has created their claim, their application, they are eligible. The next step that AFLAC is going to go through is asking, okay, well, does this employee have documentation? Have they sent in documentation to support the leave that they're requesting? And so the documentation required is going to be closely linked to the leave reason that the person has cited. So, if somebody is needing to be out of work to bond with a new child, the documentation is going to be proof of the birth of the child or proof of the placement of the child through adoption or foster care. Similarly, if somebody is taking leave to care for a family member, then they will need to send in a certification form completed by that family member's healthcare provider, showing that that person has a serious health condition and needs care. If it's military family leave, then the employee will need to send in their family members proof of call to active duty. And if it is medical leave, then the employee will need to send in, similar to the care of family member certification form, but completed by their own healthcare provider, showing that they have a serious health condition and it's keeping them from working. And then finally, if somebody is filing a claim for paid family medical leave for safe leave, then that documentation would be an attestation that the employee is experiencing an unsafe situation. So again, like in our mental hypothetical here, you have somebody who is eligible. They've sent in documentation that's tied to the reason they need to be out of work. Next, AFLAC will do a benefit calculation. High level foundational statement. Want to make sure everybody understands that Maine paid family and medical leave benefits are a partial wage replacement. They are not intended to be 100% full wage replacement. The way the program is designed and envisioned, the program is intended to provide partial wage replacement. And to calculate that partial wage replacement, AFLAC is using the same quarterly wage data that we talked about earlier, the first four, the last five calendar quarters. So that base period wage data is used both for eligibility and then also to figure out how much money somebody might be getting in benefits. So that four calendar quarters of wage data gets added up and divided by 52. That is the person's average weekly wage for the purposes of this calculation. And then that number gets run through a relatively complicated equation. It's a tiered calculation intended to, the result is that lower wage earners get more of their average weekly wage replaced at a higher percentage, which we'll see on the next slide. But there's a calculation that number gets run through, and there's a maximum amount. There's a maximum weekly benefit amount. And that's the same as the state average weekly wage that we talked about before. So let's go to a slide that is a little bit dense, but it's intended to show a few hypothetical examples of what this might look like. So the first row here is an example of sort of what I was talking about in terms of lower wage earners versus higher wage earners. This example where somebody files a claim and their base period earnings, so that 4 calendar quarters of wage data, adds up to $15,600. Divide that by 52, it's $300. All of that $300 is going to get replaced at a 90% rate for their wage replacement. And then if you go up to somebody who maybe has a base period earnings of $57,000, that divided by 52 is 1,096. Part of that is going to get replaced at 90%, and then part of it will get replaced at 66%. And then those numbers get added up for your weekly benefit amount. And then the third hypothetical on this slide is the example of a higher wage earner where their base period earnings tally up to $90,000 divided by 52, 1,730. Again, part of that is going to get replaced at 90%. Part of it's going to get replaced at 66%. The real important part of this lower line is just to demonstrate that the maximum weekly benefit amount will kick in. And that's what the person's going to receive. So nobody, at least, until the state average weekly wage gets updated, nobody's getting a weekly benefit amount that's more than $1,199. So no matter how high your base period earnings are, same maximum weekly benefit amount applies to everybody. So that weekly benefit amount is sort of the foundational, that's what somebody would get for 1 week out of leave. But sometimes there's going to be some adjustments to that weekly benefit amount for certain specific reasons. One of the most common is that weekly benefit amount, dollar amount, can be prorated if the worker is taking a partial week absence. So a partial week of absence could look like intermittent leave. Maybe somebody has taken 1 day off because they are experiencing a migraine. A partial week proration could also come into play. If somebody is taking, let's say, 6 weeks off from work and they work Monday through Friday, and let's say they worked Monday, Tuesday, Wednesday, and then they went out of work on a Thursday. So that Thursday and Friday at the start of their leave would be considered a partial week, and that would be 40% of a 5-day week. And then the following week, assuming they're out Monday through Friday, that's weekly benefit amount times 1. There are a few statutorily required reductions. So if somebody happens to be receiving workers' compensation or unemployment benefits for the same time period as Maine paid family and medical leave benefits, then what will happen is the Maine paid family and medical leave benefits will be reduced or offset to account for the unemployment or workers' compensation. And also somebody who has applied for Maine paid family and medical leave can ask AFLAC to do tax withholding on any benefits that might be taxable. So those are some reasons why that weekly benefit amount might be adjusted before a benefit is finalized. I want to note some areas that will not cause a weekly benefit amount to be reduced, because this is a question that comes up relatively often. So, and also tying back to what we talked about a couple slides ago about how this is intended, the way this program works is it's partial wage replacement, recognizing that a lot of times people who are out of work, it's great that we have Maine paid family and medical leave to provide partial wage replacement, but a lot of times, you really need functionally to be taking in the amount of money that you're used to, for various reasons. So if somebody needs to sort of top up, so take their partial wage replacement and really get up to the level that they are used to earning, use of PTO is available for that. And that's obviously something that an employee and an employer would need to talk about. But wanting to make the point here that if somebody chooses to do that, if somebody chooses to say, okay, well, I want to use some of my PTO to make sure that what's hitting my bank account in total is about what I'm used to, that use of PTO is not going to change what the person is getting from Maine paid family and medical leave. The same is true for any short-term disability insurance policies that might continue to be in place. The Maine paid family and medical leave program is not going to take in that information about what somebody might be getting from one of those programs. Those programs might have provisions to ask, well, what are you getting from Maine paid family and medical leave and offset there? But the Maine PFML program is not going to be accounting for that. At the end of the day, it's really an employer's responsibility to make sure that their employees are not essentially, double dipping. The program is not intended to, it's not the intent of the program to have somebody, for example, taking 40 hours of PTO and also made PFML benefits. So employers and employees should be working together to make sure that the end result is about the same, and not a lot more than what somebody would be earning if they were still at work. All right. So I want to talk a little bit about how AFLAC is going to interact with applicants and employees. So again, there's an AFLAC employee portal. Start at maine.gov/paid leave. Click on I am a worker, and the AFLAC portal link will be right there. That's available 24/7. Benefits start on May 1. So in order to be approved for benefits, your time away from work has to be on or after May 1. But AFLAC's portal and call center are open now. So they are taking pre-applications for people that know they're going to need to be out of work on or after May 1. So the portal is available 24/7. Their call center customer service support is open Monday through Friday, 8 to 5. So the things that an employee can accomplish by using either one of these mechanisms, set up a claim, add time. So if somebody sets up a claim and then realizes, oh gosh, I need an additional week to recover from a medical, something like that. Through the portal, once a claim is already set up and in the AFLAC system, there will be a case manager. And so an employee can go in and ask a question, send a portal message and ask a question of their case manager. The portal is a great place to send in the documentation we were talking about. So there's a way to upload forms and things like that. Also, an employee can go into the AFLAC portal and set up preferences for how they want any benefits that are approved and payable to be paid. So AFLAC can do direct deposit. So enter your bank account information. And if your claim gets approved and you're getting benefits, they will direct deposit that for you. If somebody doesn't have a bank account, AFLAC will instead put those benefits on a prepaid debit MasterCard and put it in the mail. And then, so if somebody has a claim and changes their mind, for example, oh, actually, I do want to use the direct deposit feature, you can go in, log into the portal, and enter your bank account, even if you chose not to do that during intake. The portal is also a great place for employees to go in and view correspondence, claim updates, things like that, and also change preferences for how AFLAC communicates with you. So whether that's wanting to get letters in the mail, get communications electronically, and also whether somebody wants to get text notifications about, hey, you have something in your claim, log in and go take a look. And then AFLAC will also have some interaction with employers. So there's also an AFLAC employer portal, similarly, will be available 24/7. For any folks that are, in the audience here who are looking at this from more of an employer perspective, again, like I said earlier, there's a few recorded webinars that are more employer centric on our website, maine.gov/paid leave. But just to quickly talk about that here as well, if you're an employer that needs and wants to log into the AFLAC portal to see, for example, oh, my employee filed a claim and wanting to interact with AFLAC in that way, the way you do that is actually to go into the existing Maine paid leave portal. So if you're using that for quarterly wage data submission, premium contributions, then you'll already be familiar with that. And so within that existing portal, there's a link that says Access Maine PFML Benefits Portal. Click on the link, enter the same credentials that you use, the same username and password that you use to get into the Maine Paid Leave portal, and it'll plop you into the AFLAC universe. So we wanted to make it as easy and seamless as possible so you don't have to go into AFLAC and create a whole new password and a whole new username. It's the same credentials. So once an employer is in the AFLAC employer portal, they'll be able to see which claims have been submitted, what the leave reason and the requested dates are for each one, see whether each application has been approved or denied or canceled, or if it's still pending, and also interact with AFLAC to provide information that might be needed or helpful in that. Another super quick thing to just note, if you are an employer, the notifications that AFLAC sends will be sent to one specific email address that you can designate and indicate, called the claim contact email. And to do that, what you would do is you would go into the existing Maine Paid Leave portal and designate your claim contact. And that's how you can basically tell AFLAC, here's where we want you to send all of the notifications for the employees in our organization. All right, 6:17. So I'm going to talk about the next couple of slides relatively quickly so we can save a few minutes for Q&A. So again, once the Maine Paid Family and Medical Leave application is filed, there are a few things that workers can do to help the process go as smoothly as possible. The first one is just really to do with communication. So a few slides ago, we talked about the importance of employees and employers maintaining a good line of communication. The same is true with applicants, employees, and AFLAC. So workers who've applied for Maine Paid Family and Medical Leave can make sure that their application review process goes as quickly as possible by really just paying attention. If AFLAC is sending a communication, read and respond as quickly as you can. All of the information that they're requesting is really important. So proof of identity. So we're, trying to mitigate fraud and identity theft as much as possible. So AFLAC has systems and processes in place to make sure that that's being addressed as thoroughly as possible. So send in proof of your identity, documentation for why you need to be out of work, and just stay in communication in terms of, oh, I've already returned to work. I didn't need as much leave as I thought I would, or I need to extend my leave a little bit, just making sure that you're staying in communication there. And then if you are a worker who has applied for leave, you do all the things. AFLAC approves your leave. You may be receiving benefits. Like I said, benefits can be sent by direct deposit directly to somebody's bank account. And I think it's important for folks to fully understand AFLAC is going to be running these payments once a week. So what will happen is all of the PFML claims that get approved over the course of, a 7-day period, all of that will get batched up, and the direct deposit process will run once a week. I believe it's on Thursdays. So again, it's really important to stay in contact with AFLAC if they're looking for information, sending your documentation in, because the timing of when a leave gets approved and then the payments get sent out, it's really important to make sure that you get that information in. So hopefully you can get into the next batch of payments if you do get approved. Again, for folks who are unbanked or just don't want to share their bank account information, the alternative approach is that AFLAC will put those benefits on a prepaid debit MasterCard and put it in the mail. So employees can go in and update that information whenever they feel like they want to do that. And then finally, because sometimes this will happen, AFLAC in their review of a PFML application might land on a decision that an employee disagrees with. So if that happens, if somebody has filed for a Maine PFML and then they get a letter saying, oh, you're denied, or, some other outcome that the employee does not agree with, there's a process specifically intended for this eventuality. So what would happen is the employee would go back to AFLAC and ask for a reconsideration. So that's an AFLAC process. So the worker would fill out a form, a reconsideration request form, and what AFLAC will do is go back through, look at any information that perhaps the employee did not provide before that is now present within the claim. And so AFLAC will take a look at that based on the reconsideration request and, see whether the decision can be changed or not. And that reconsideration process will be outlined in that letter. So if there's a situation where AFLAC is sending a denial letter, the instructions will be right in there about how to request a reconsideration. If that happens and the employee says, hey, can you please do a reconsideration? AFLAC does the reconsideration and the outcome doesn't change, then an employee can choose, doesn't have to, but an employee can choose to then file an appeal. And so the distinction is the reconsideration process is all done by AFLAC. If somebody chooses to then file an appeal, that's a Maine Paid Family and Medical Leave Bureau process. So that's not an AFLAC process. And so again, at each stage of this process, the letter, the communication that AFLAC sends will have instructions on what the person needs to know and potentially do if they want to pursue either the reconsideration process or the appeal process. So that's a lot of information. I recognize I was talking a little bit quickly on some of those slides, but I just want to end by thanking everybody for listening to the last 50 minutes or so, and also just remind folks, maine.gov/paid leave is just a fantastic resource for more information, FAQs, recorded webinars, and updates, and just wanting to make sure that we say that yet again. Reggie, what's the Q&A looking like?
So I'm not seeing many questions in the chat, but I mean, since we have a small group, I don't know if you maybe just want to switch it to if anybody want to raise their hand.